We're going to talk about a problem that affects millions of Americans and people around the world, and that is bone spurs. So the topic today is how to eliminate bone spurs, and our very special guest is Terry Lemerond. Terry Lemerond is a retailer, author, educator, and entrepreneur. He has more than 40 years of experience in the natural products industry. He has researched and developed over 400 nutritional and botanical formulations, and many of these are still top-selling products in the market today. He has a personal website dedicated to health and nutrition at terrytalksnutrition.com. And so it's with great pleasure I introduce to you Terry Lemerond. Welcome, Terry.
Well, thank you very much, Cheryl. I appreciate that very much, and let's get right to work. In fact, I let people ask me questions when I'm on tour and give lectures, or I even allow them to write into terrytalksnutrition.com and ask their questions. And I receive questions on what happens in arthritis, or what causes arthritis, or what can I do about arthritis, or bronchitis, or sinusitis, and all kinds of conditions. They write in for all kinds of health problems. But the number one question that I receive from listeners, readers of all kinds is, I have a bone spur, and how do bone spurs collect on the bone, and what can I do to help eliminate that bone spur? Please help me. That's the number one question I get from listeners and readers from all across the country. What is a bone spur, and why does it cause so much pain? Well, first of all, a bone spur is caused from dead calcium crystals. And they're deposited around the joints, on the bone itself, especially in the heels, shoulders, and back, the spine. We can have all kinds of bone spurs, multiple bone spurs, and all various different sizes of bone spurs. What is a bone spur? Well, first of all, it doesn't grow off the bone. It's not a spur of the bone. It actually is called a bone spur. I don't know why they would call it a bone spur, because it really isn't a spur off the bone as you would think it is. You would think a spur would be off the bone, but really it is a collection of calcium crystals that have been drawn out of the bone itself, or the bone reserves, and it's deposited on the bone. And in fact, in some cases, there is nothing that doctors can use as a drug to eliminate a bone spur. So a common practice is to do an operation. Open up the area where that bone spur is attached to the bone and scrape it off. This means downtime, loss of work, loss of an income. There's a lot of reasons why I don't find that to be the most practical case or practical, reasonable method to remove a bone spur. 40 years ago, I learned from a physician of a combination of nutrients that can actually remove the bone spur, and I'll get to that just in a few moments. But when these bone spurs, or deposits, calcium deposits, I guess is a better word. I don't like the word bone spur. I guess that came from the medical community. It's a deposit. And if it rubs against other bones, or against muscles or tendons or ligaments, it hurts. If you have one on your heel, a bone spur on the heel. And they usually form where there's a stagnation of function. If we jump down off of a truck, or we somehow injure our heel, and they form in the most common places where we have an injury. And it seems like sometimes it forms there because we have a stagnation of blood flow, or stagnation of fluid flow. So it forms in an area where it has the least challenge against it being removed. And it usually falls where there's been an injury. But it's only a deposit of calcium crystals that occur there. It's not really bone. As we continue to eat a very, very high diet, that is high in acids, the body has to try to correct those acids. It has to reduce those acids. It has to buffer those acids. So the most common buffering substance we have in our body is calcium. So as we continue to drink a lot of coffee, which are high in acids, a lot of soft drinks that are high in phosphoric acids and other types of acids. In fact, if we would drop a bone or even a tooth into a glass of Coke, that tooth would dissolve over time. Those are very, very strong acids. So as those acids come into our body through beverages and foods, the body has to try to balance a combination between what is the proper level of alkalinity to acidity. So calcium is the most common buffering agent because it is an alkaline substance. So it's drawn out of the bone reserves to neutralize the acid in the body, but now it becomes a dead form of calcium. It becomes a calcium that no longer can be reabsorbed into bone again, and it collects in areas where there's been an injury or a hurt. Now, if you were walking on the beach, someplace in Florida, and water comes in and water goes out, but sometimes as the water comes in, it forms clumps of sand. So if you're walking and you picked up a hard ball of sand, it really isn't hard. It's clumped together because as the sun dries the sand after the water's been in, you'll find various clumps of sand. You pick it up and you can crumble that sand in your hand. You can clump that in your hand, you can crumble it. It goes back into sand again. And these are crystals, just the same thing. In fact, if you could get to an area where there's a bone spur and massage it carefully, and so you don't damage the surrounding tissue, you can dissolve that bone spur by just massage. It is not a spur that is there permanently. So it's very easy to break it down, but there are also various nutrients that can help to treat the bone spur. So the long-term goal is get rid of the acid tummy, the acidic part of the body, get back to basic. Proper pH of the body is acid in the stomach and slightly alkaline in the blood and other tissues. An acid stomach promotes mineral and calcium absorption properly and correctly. Alkaline blood keeps minerals in bones. So step one is temporarily increase the pH, create acidity. I shouldn't say we should increase the pH, we should lower the pH. We want to increase and temporarily improve acidity to dissolve the calcium deposits so to boost mineral intake. So we want to reduce inflammation and relieve pain, and we want to modify the diet to maintain proper calcium absorption and nutrient intake and pH levels in the long term. So acid-promoting nutrients. So how do we dissolve the bone spur without surgery or without opening up the body to be an invasive method to scrape off that bone spur? That bone spur is only a small collection of crystals. For example, you have a normal stream of water, a creek someplace. And as debris comes down that creek and it gets to a narrowing of that creek, all of a sudden a very large twig or tree or branch comes down and it blocks that narrowing and makes it more narrow, and pretty soon you have more debris, and you have a damming up of the creek, and then you have an overflow of water behind it. That's what a crystal is. You get crystals, calcium crystals that dam up together in one area, and it forms a so-called bone spur. So we want to break up that bone spur without surgery. So we want to increase temporarily the acidity of the body. So all these acid-forming nutrients, ammonium chloride. Now that sounds like a chemical. Well, to some degree it is a chemical, but it's a natural chemical in the body. It's a natural digestive constituent that's secreted in the stomach lining. Along with hydrochloric acid or betaine hydrochloride, ammonium chloride is also a natural mineral, that acid-forming mineral that forms in the stomach lining, and it promotes acid stomach, which leads to proper mineral absorption. Calcium chloride, another acidic mineral. Calcium normally is alkaline, but when you combine it to a chloride, it becomes acid-forming. And calcium phosphate, magnesium glycerophosphate, magnesium and acid-forming. And vitamin B6 or P5P, and vitamin C, which is also somewhat acid-forming. So these compounds, which are acid-forming in the body, and temporarily you want to have over-acidic to break down that calcium deposit or that calcium spur. And sometimes you can dissolve a spur in a few days. It might take a few weeks. And depending on the diet of the individual and depending on the degree of calcium deposits and the size of these calcium deposits, some people can have a whole spine riddled with calcium deposits, or in the neck area where they get so big they have difficulty even turning their neck. So this forms all the time with arthritis. You see a lot of people with very gnarled hands. They have lumps on their fingers. These are calcium deposits, and you can dissolve those over time. Some of these may take a long time, but it's possible. So this formulation of ammonium chloride, betaine hydrochloride, calcium phosphate, magnesium glycerophosphate, these are acid-forming minerals, and you need to take these sometimes 3-4 times a day, and especially at bedtime, which is a good time, to take these to break down this combination of calcium crystals. This formula has worked for many, many years and almost without fail to dissolve bone spurs. It's highly effective. Then you want to reduce the inflammation surrounding that area where there is some hurt or pain. And when you always have pain, yes, you're scraping that bone spur or that calcium deposit against the tissue, and you are causing inflammation. So temporarily you want to reduce that inflammation, and you can do that very, very nicely with a combination of curcumin, boswellia, DLPA, and nattokinase. Curcumin and boswellia are anti-inflammatory, and they work as effectively as medication, plus increase wound healing and soft tissue repair. Curcumin and boswellia relieve joint pain more effectively than a prescription drug. It's like an NSAID. 14% of patients were pain-free after 3 months versus only 7% of the drug group patients without adverse effects. And that's always the number one. Why not get better results with plant medicines that don't have adverse effects or events or side effects? So you'd want to use a combination of about 2,181 milligrams of the combination daily, which will increase, and you can increase it if you need to. You can double that dosage if you would like to. And number 3, add more protein to your diet and replace the carbs and sugar with proteins. You don't need a high protein diet. Average protein intake is great. Good quality healthy fats also is a benefit. But why do you want to reduce carbs and sugar? They're acid forming. In the body, carbs, refined carbs, and sugar always increase the acidity of the body. And then the calcium has to be taken out of the bone reserves to neutralize that acid, and then you create a bone spur. So increased protein leads to a stronger, healthier bone. Protein increases calcium absorption, especially when calcium is not consumed in excessive amounts. And a good quality protein diet is not acidifying. Carbs and sugar are. A 2017 review paper notes, many studies show that long-term high protein intake is positively associated with bone, mineral density, and reduced risk of bone fracture. High protein diet does not negatively affect calcium homeostasis, and a healthy body can easily process amino acids from protein as part of the regular diet without adverse effects to body pH or bone metabolism. Perfect combination, and what I always recommend anytime for prevention or for treatment, always follow a ketogenic diet. So I'll recap it. If you want to make a bone spur disappear, or I should say if you want to make a bone spur, you could do it that way too. A perfect scenario for a bone spur to occur when you turn down stomach acid, and that happens all the time. As we get older, we start slowing down in every aspect of our life, right? As we age, we don't run as fast when we're 80 as we did when we're 20. Now, some people can't even walk when they're 80. We don't process all of our foods. We don't digest our foods as well when we're 80 versus when we're 20. When we're 20, we think we can do no wrong. And when we're 80, we think we can do no right. So everything is kind of turned upside down. So we don't digest as well. We don't secrete as much hydrochloric acid because everything slows down. So we just don't pump out enough hydrochloric acid in the stomach to digest our foods. And then many people, because of the acidity, they're prescribed a PPI, a proton pump inhibitor, and then that blocks all secretion of acids in the stomach. And we need acid in the stomach to maintain a sterilized environment. So we kill the bacteria, we kill viruses, we kill candida. We want a sterile environment. And that's the only way we can break down proteins, calcium, iron, zinc, and other minerals as well. So when we eat lots of carbohydrates, grains, and sugar, and little protein is a perfect combination for increasing bone spur formation. And that increases the inflammation. Don't get enough calcium and potassium and vitamin D. This also works well for creating related conditions like arthritis, osteoporosis, plantar fasciitis, and tendonitis. They're all related, and this could also be associated with the acidity and pH of the body. Now, to dissolve that bone spur and relieve pain, use acidifying nutrients with meals and before bedtime. Ammonium chloride, betaine hydrochloride, calcium chloride, calcium phosphate, magnesium glycerophosphate. All of these are acid-forming nutrients, acid-forming minerals. They're not the alkaline-forming, they're the acid-forming. You want to keep the body in an acidifying state. And you can do this 4 times daily until bone spur is gone. So relieve pain and inflammation with curcumin, boswellia, DLPA, and nattokinase. And make dietary changes. This is so important to keep your body in a balanced state of metabolism. Good quality proteins, healthy fats. Don't be afraid of fats. We need fats to be healthy. And we need saturated fats to be healthy. So include good quality coconut oil, extra virgin olive oil, avocado oil, sesame seed oil. Those are good, really good quality oils. And include butter, cream, lard, and eggs, all the good quality fats. We need fats. We need phospholipids. And then cut down your carbohydrates and your sugar. In fact, don't cut down on your carbohydrates and sugar. Cut them out. If you're going to eat carbohydrates, make sure they're good complex carbohydrates, not simple, refined, processed carbohydrates. And sugar, there's no such thing in the diet. So you want to cut that out entirely. And if you want more about diet, go to terrytalksnutrition.com diet, and you'll get an idea of how I eat and how I think everybody should eat for a good, healthy intake.